Good afternoon, everyone, and welcome to the Multicultural Media Online Conference hosted by the Ministry of Health, New South Wales Multicultural Health Communication Service, and Multicultural New South Wales. I'm Jesusa, Helaratne, Deputy Director of the Multicultural Health Communication Service, and it's a pleasure to have you on our program today. We have, of course, the Honourable Minister for Multiculturalism, Mark Coure, joining us to answer your questions and give some updates, and of course, Dr. Jan Fizzell, the Senior Medical Advisor of New South Wales Health. We would like to begin by acknowledging the traditional owners of the land from which we are all meeting today. We pay respects to elders past and present, and from us here, for Dr. Jan and myself, we acknowledge the traditional custodians of the land, the Camaragal people of the Guringai tribe of the Eora Nation. We also pay respects to elders past and present, and also those from multicultural communities represented today. As we have only 30 minutes, we'd like to please request if you can keep your microphones on mute, and we'll try to answer your questions on the chat. So please have them ready for us. We also want to thank those people who have sent through their questions in advance. We'll try to answer them first. So let's begin. We'll ask Minister Coure, how are you? Hope you're well, and it's great to see you again.
Well, thank you very much. It's great to be back here, and I want to welcome each and every one of you today joining us this afternoon for this Multicultural Media Conference. I think this is a great idea, and it's a great initiative that we are going to continue for weeks and months ahead.
So, Minister, would you like to give us any updates or any announcements that you have?
Yeah, certainly can. Thank you very much. Again, this is a great opportunity to let the community know that we're rolling out rapid antigen tests in partnership with multicultural groups. This week, we delivered 3,000 tests that will go out to multicultural communities through the Ethnic Communities Council, both in Hunter, Wagga, Illawarra, and of course in Sydney. And this is part of a package of 50,000 rapid antigen tests secured for multicultural communities. And there are another 14,000 being sent to community organisations in the next few days. And we'll continue to work with partner organisations to ensure tests are delivered to vulnerable communities across the state and distribute the rapid antigen tests. We are working with organisations that support temporary visa holders, asylum seekers, and of course refugees. Organisations that have previously applied for funding through COVID community support grants, and of course, as I mentioned before, through the Ethnic Communities Council. So this is certainly great announcement this week. And I do want to thank, of course, Peter and the team from the Ethnic Communities Council for their wonderful leadership as well. In regards to other bits and pieces, I'd like to sort of give you an idea of, or an update, I should say, on vaccinations and booster shots. I just want to remind everyone on this call that, you know, getting a booster shot is one of the key things you can do to keep the community safe and to keep yourself and family safe as well. It's been 3 months or more since, if it's been 3 months or more since your second COVID-19 vaccination, it is time to get your booster shot. And if you've had COVID-19, it's recommended that you get your booster shot after a month. Correct me if I'm wrong, but certainly we are working with New South Wales Health and Multicultural New South Wales to ensure that our translations and the translation team continue working with agencies right across government to translate a variety of resources on booster shots, including, you know, video content from health professionals, and as I keep reminding multicultural media, it is so important that, you know, once you see that translated material, that video content, send it out to your communities, because we want to pass on the message that New South Wales Health is putting together for us. And that's probably enough from me for a quick update. There's a few other bits and pieces that we're doing in terms of you know, translations and rollouts and so forth, but we can cover that during the media conference.
Thank you so much, Minister Coure. It's wonderful to hear the news about rat tests being delivered and distributed to multicultural communities. Thank you for that update. And so, Dr. Jan Fizzell, how are you? It's nice to see you.
Good to be back again this year.
And you have a lot of updates to share with the media.
Look, I think the key things that we need to know that New South Wales Health has changed its reporting times at the moment. So for this cycle, we're on a 20-hour cycle. We'll be moving to a 24-hour cycle where our numbers are cut at 4 p.m. rather than 8 p.m. each evening. And that just reflects the fact that we're moving more towards a business as usual type of thing. So please, the numbers will be a little bit lower today potentially, and we'll continue at a 4 p.m. cutoff into the future. One of the key things for people to know is that we had 11,800 positive tests, including 6,300 odd rat tests and 5,490 PCR tests. And just as those rat tests are rolling out in the community, I'd just like to reinforce that if somebody has symptoms and they don't have a rat handy, those PCR testing clinics are still available to you, and you can still use those clinics to get a result. In Sydney, we are seeing those turnaround times within 24 hours again. So please, if you've got community members who are concerned that they haven't got a rat and they have symptoms, please keep encouraging them to get tested at one of the testing sites across New South Wales. It's also important to recognise that we had 27 people pass with COVID-19. We are seeing the young, the old and the very old passing from COVID-19. The thing that we really are seeing though is an overrepresentation of people who either haven't had their booster or haven't been vaccinated at all. So please do keep encouraging your community to take up the opportunity of vaccination, and as the boosters become available for people who've had 3 months since that second dose, as the Minister said, please do make sure that they're aware that those boosters are some of their best protection against the Omicron variant, which is our dominant variant here in New South Wales.
Thank you so much, Dr. Jan. It's a good to hear those updates. And we'll start the questions. We've got some questions here from the community media as well as from community members. But we'd like to ask Minister the question about how safe are students in schools at the moment. That's one of the questions that's come up.
Well, that's a really good question. And we've obviously made an announcement recently about students being sent back to school, or school starts this week. And certainly my 7-year-old went back to school yesterday. Many parents have got rapid antigen tests. In fact, all parents should have by now the rapid antigen tests that school has allocated to each parent. Look, the best thing for a child is to be in front of the classroom, and we're backing that up with those rapid antigen tests over the next few weeks, where students will be tested at home. Look, at the end of the day, there will be, it's not going to be easy. It won't be easy at all. But as I keep saying, the best thing for a child is to be in front of the classroom. And, around the world, many kids in many countries are back at school. So, there will be, in some cases, there might be issues. I don't know. But at the end of the day, we're doing everything we can to make sure schools are equipped with all the PPE equipment, and they're equipped with all the hand sanitizing. And of course, they last week before school started, equipped with all of the rapid antigen testing for kids to use over the next 4 or 5 weeks.
Thank you so much, Minister. A question here from Vayoli Calvert from Radio Tanggapai Filipino radio program. Are authorities aware of Mount Druitt POP clinics and other testing clinics which are sending the results more than 10 days, which are affecting a lot of the community members? So, Dr. Jan.
So what we do know is that over that Christmas, New Year period, we had unprecedented demand on some of our clinics, and some of the excess tests were taken over to other labs. Now, people would have had the opportunity to get those results either having registered for SMS or by having rung for their result. Unfortunately, we have a system where, or fortunately, because it's worked really well up until this, we have a system where when information is entered into our laboratory information system, it's automatically imported into our databases, from which we message people with public health messages and care messages. So we do know that some New South Wales health pathology results, things that people may already have known about, have gone out quite late. However, please, if you're concerned about having got one of those messages, do call. We're happy to clear that up for you. But as I say, right now we're down to a turnaround time in Sydney of around about 1 day. So that shouldn't be what's happening. If people are finding that their results are not back within 24 to 48 hours, they should be contacting the lab where their test was taken.
Thank you so much, Dr. Jan. And we have some resources translated for you in various multiple languages. So we'll be putting that in the chat for any resources available. A question from Fatin Dana from 2MFM Arabic Radio. Due to the increased number of those who died with COVID under the age of 60, despite being fully vaccinated, some people are feeling hesitant to get the booster dose of the vaccine because they believe it won't be effective. What do they say to them from a health perspective? And as well, I'll take Minister Coure's comments on this. Dr. Jan.
So I think the key thing for us all to understand is that no vaccine gives us absolute armoured protection against everything, but it does give us our best chance. If we weren't a vaccinated population and we had Omicron spreading, we might have been seeing some of those terrible scenes that we've seen overseas that people saw with Alpha and Delta when there wasn't a vaccinated population. So the booster is our best barrier to that becoming scenes that we see here. So please, that booster is working. It is absolutely working, despite these soaring case numbers and despite the immense pressure some of my colleagues, at the coalface have had. We are not seeing the extraordinary numbers we would expect to see being hospitalised if the vaccines didn't work. So the key thing is that those boosters are our best evidence to show that they are really giving good protection, particularly as people potentially first eligible for the boosters are our most vulnerable people. So they're the people who've already had the boosters because they became eligible first. Now, as the vast majority of the population becomes eligible for those boosters, we can give that same protection to more people in the population.
Thank you, Dr. Jan. Minister Coure.
I'll take you off mute. Look, at the end of the day, I think, sorry, just hold on for a sec. At the end of the day, the booster shot is by far something that I fully support. And I think at the end of the day, I think, I encourage everyone, if they haven't had that booster shot, to make sure they get that booster shot. I think the booster shot, as Jane had mentioned already, it adds that extra level of care and security, particularly after you've had the double shot vaccination. So, for those that have had that vaccination already and the second dose, there is a period of time that you've obviously got to wait, and that is, after 3 months. So if it's been 3 months or more since the second COVID-19 vaccine, it's time to get your booster shot. And that's a message that I can't stress enough. I think it's really important that, our multicultural media send that message across to the multicultural communities out there right across New South Wales, and encourage your communities to get the vaccine, to get the booster shot after 3 months.
Thank you so much, Minister. And also the question about that confusion of when does a person who has had COVID get the booster?
So the advice from our Chief Health Officer is 4 to 6 weeks after you've recovered from COVID. That's probably the good window to go and get that booster if you hadn't had it beforehand.
Thank you, Dr. Jan. Minister Coure, a question about people going online, and that's a message that we're trying to promote to people and still is to register and check in. How important is that for the community to keep doing that?
Look, to register your booster shot, to register your vaccine shot, to using the QR code, all of that is very, very important. And I think it's, again, with the vaccine, that getting that booster shot is very important for our community. It keeps our community safe. It keeps you and your family safe as well. And I encourage, particularly in my case, for all those on the Zoom that have got school-age kids, get your kids boosted or get them to have that vaccination because it's really, really important. We want to make sure that we try and keep this under control.
Thank you, Minister. A question here, Dr. Jan, can you please provide an update about the status of surgery activities? And also, sometimes there's some questions about the difference of non-urgent elective surgery between emergency or elective surgery.
So the good news is that we're starting to increase our non-urgent elective surgery again. We have categories of surgery. Emergency is something that has to be done right now to prevent damage to a person's life or limb. Then we have urgent elective surgery, which is surgery that needs to be performed within 30 days. And then we have less urgent surgeries. The people who make the decision about those categories are the surgeons. They're not bureaucrats. They are the doctors who are providing care for people as to which category somebody goes into. So from next Monday, the 7th of February, our non-urgent elective surgery requiring an overnight stay will go back up to 75% capacity in private hospitals and up to 75% of pre-pandemic activity at public hospitals in regional and rural New South Wales, where they're able to do so. That'll mean that some of the people who maybe have been looking, you know, for their operations on their knees or other things are able to have those surgeries performed again. The temporary suspension of non-urgent elective surgery was to ensure that we had that capacity to provide for that surge in COVID cases that we saw and to protect patients so that whilst we had a large number of people with COVID in hospitals from getting infected with COVID, because that's also not a good outcome for people, but people who needed that emergency or that highly urgent surgery that I spoke of have been receiving that surgery right through the pandemic period. Our private hospitals will keep helping the public hospitals, making sure that people can get their surgery as quickly as possible. So we're doing what we can to keep people safe, as well as to make sure that people are not unnecessarily inconvenienced by having that essential healthcare delivered to them in as timely a fashion as we can do safely.
Thank you so much, Dr. Jan. Here's a question about the Omicron subvariant, and this is again from Arabic media. We hear that the Omicron subvariant has been detected in Australia. What do we know about these properties and the threat it poses? I guess I'll ask that to you, Dr. Jan, from a health perspective. But Minister Coure, how ready is the government, and the community for any other variant that's possible that could come along? So, Dr. Jan?
So what we know of the subvariant so far is that it can be more contagious, but it doesn't seem to be producing more serious illness, and it doesn't seem to be escaping from the vaccine. So if you've had your 3 doses of vaccine, you are as protected against the variant as you were against Omicron. So at the moment, we're keeping a close eye on it. We've had a number of people in New South Wales identified as having that particular variant. To date, we haven't seen a particular link between those cases. So it's possibly circulating in our community, but not causing, increased angst over the Omicron variant that we already had here. That was enough angst. Thanks very much.
Thanks so much, Dr. Jan. Minister.
Well, look, it's a really good question, and certainly I've seen the news reports over the last couple of weeks about this extra variant, or this variant, I should say. I think what we're seeing is, or what I can encourage everyone is to, continue, as I keep saying, get those booster shots. Make sure you and your family are getting vaccinated. And of course, today, not just today, but this week, in fact, the announcement in terms of rolling out the rapid antigen tests. I mean, this will go a long way to try and contain this variant and then future variants, if there is one. These rapid antigen tests in partnership with multicultural groups will go a long way. And as I said before, we delivered 3,000 of these to the Ethnic Communities Council on Monday, and we'll see across agencies working at a time frame to deliver these rapid antigen tests across vulnerable multicultural communities in the next few days and weeks ahead.
Thank you, Minister. And if you have any questions, please put them on the chat and we can have them answered by Minister Coure and Dr. Jan. Dr. Jan, how much protection will I have if after 3 booster shots or after 3 shots, if I already have 2? So that's a question that's come through.
So the key thing that you will be is you'll be far less likely to become unwell enough to need our hospital care. Far less likely to be unwell enough to be in ICU, and your family is less likely to have you pass from COVID-19. At the moment, an unvaccinated person has around 13 times the risk of being in ICU as a vaccinated person. So The other thing we're seeing is with our older people, again, it's unusual to see them pass if they've had the 3 doses compared to the 2, which is why we've been working to try and encourage that booster program across all sectors to make sure that older people particularly, because many of them had their AstraZeneca, it's now a number of weeks since they finished their AstraZeneca course. It's really important that people, you know, particularly older people, are going and getting that 3rd dose for protection, because we do know that from the AstraZeneca, the antibody response doesn't mean all the immunity response has waned.
Yeah.
And so it's particularly important for that group to go and get that booster dose. It makes a huge difference to their, you know, as to whether they'll need one of our hospital beds or not. And we're trying to do everything we can to keep people out of hospital.
Thank you, Dr. Jan. And Minister Coure, you've been doing a lot of engagement and communication through talks with the community as well in promoting these messages.
Yeah, look, we certainly have. We're doing weekly forums, stakeholder forums with community groups. And I think it's really important that, you know, in partnership with New South Wales Health and, of course, Multicultural New South Wales, we continue spreading that information. We try and get that information out to as many of our community groups as possible. I've been out and about today and during the week already visiting, you know, the Sai Temple at Strathfield, or Reverend Bill Cruz this afternoon. Again, you know, ensuring that our communities follow the health advice, they stay safe, reminding them of the you know, encouraging people to make sure their staff or their community get the booster shots, and more importantly, also reminding them that we are here to help in any way we can. I mean, Multicultural New South Wales, you know, has allocated a record 54.7 million in support to, you know, vulnerable people and multicultural communities experiencing hardship during the pandemic. We'll continue to do so over the next few weeks and months ahead, and just reminding people that, you know, we're here to help in any way we can.
Thank you so much, Minister. The question here, Dr. Jan, is it easier for parents to use a saliva test kit than a nasal swab? And will the government change the saliva test in the future?
Some families will have received saliva tests as part of the school program. Some of them will have received nasal swabs. Basically, what we've tried to do is make sure that every family has got access to one form of test or another. With the saliva test, it's really, really important that you do it pretty much as soon as you get up. Eating and drinking, particularly acidic things, can actually change the results of those saliva tests. So there are logistic problems with the saliva test if you've got a small one who likes to get up and, you know, have a drink of milk or whatever first up. So they've both got their pluses and minuses, but I think the key thing is, as parents, how we approach the test. If we say, oh, this is not going to be good, there's a very good chance that the young person that we're trying to get to test is going to say this is not going to be good. The other thing is, of course, one of the good things with the nose swabs is that a lot of kids will rapidly adapt to doing it themselves, and it's often much more comfortable. And you as a parent or carer can also have a look and just make sure that the swab seems to be going far up enough up the nose and is there for long enough. But a lot of kids, once they actually get that idea that they can do it themselves, will feel a lot more confident. If they're really excited about it, you can always use a cotton bud to practice with if you're worried about using the rat test up.
Thank you so much, Dr. Jan. And a question here, when should I call 000 or 000 if I have had COVID?
Look, the key thing is for people, if you're finding that you are having trouble breathing. So if somebody is having trouble breathing, they can't talk in a full sentence, they can't get up, walk to the front door and back, if they're confused and not making sense when they're talking to you, or if you notice that they're blue around the lips or on their fingers, they're all good times to call 000. If you've got other symptoms and you're concerned about somebody, say, running a high fever, or you're worried that of a different symptom, there are the Health Direct numbers on the 1-800. If they're concerned, they'll direct you to the ambulance, or else they'll give you some advice to help you manage those symptoms at home. But basically, you should be able to look after yourself. You should be able to walk to a door and back without falling over and being very dizzy. You should be able to take a breath, and you shouldn't feel so short of breath that you can't talk to people or you can't do basic, going here and there, and you should certainly make sense when somebody's talking to you. And people can change their symptoms very rapidly. Somebody who's quite well in the morning can be quite unwell in the evening. So it is important that if we're checking in on someone remotely, that we don't just do it once a day, that we might do it in the morning and the evening just to make sure everyone's okay.
Thank you very much, Dr. Jan. And Minister Coure, in terms of those messaging, it's so important to have them in language, and I think that's what's that you're promoting as well.
Look, it certainly is. And I think what we're seeing here is Multicultural New South Wales working with New South Wales Health, and both agencies and departments have done an excellent job in making sure the latest health advice is translated. And as as part of that, we're seeing much more translated material as quickly as possible out there into community groups, and through Multicultural New South Wales and the great work they're doing. And I do know Joseph Laposte is on this Zoom here. They're getting that material out to many of our religious and community organisations as quickly as possible, because at the end of the day, the organisation and their leaders are out there making sure their communities are safe as well.
And I understand, Minister Coure, that in delivering PAC's translated resources and fact sheets are also delivered with the translated resources.
Look, they certainly are, and they've been working closely. Multicultural New South Wales has been working closely with New South Wales Health, and the Department of Customer Service as well. To ensure the important health messaging is being translated into for multicultural communities. Last week alone we've seen a range of content, posters, online videos and ads, fact sheets, social media posts, really focusing on the importance of getting the booster shot. Focusing on the RAT registration, the rapid antigen registration through the Service New South Wales app, and of course, action plan for people who become positive. So there is a lot of information out there. I'm making sure as Minister for Multiculturalism that no community will be left behind, and that their translation services are there to help.
Thank you so much, Minister. And I'd like to follow up a question in terms of some communities who are facing some tragedies back home. For example, in the Pacific community are experiencing, aside from anxiety with COVID, there's also the tragedies happening back home.
Look, there certainly is. And yesterday alone, I launched quite a significant information booklet for the Pacific communities, which was announced yesterday. The booklet itself, through New South Wales Pacific communities and of course all of their associations, saw an information fact sheet or a booklet, which was provided a lot of material for everything from those that have tested positive to those who have family members who have tested positive, to activities that families or kids in particular could do. It was quite a comprehensive book that we launched yesterday online, and I want to thank Multicultural New South Wales, New South Wales Health, and of course the Pacific communities that helped put that book together.
Thank you so much, Minister Coure. And Dr. Jan, you were part of that in terms of consultation together with New South Wales Health, Ministry of Health and the Multicultural Health Communication Service, and of course funded by Multicultural New South Wales. But how important are resources from communities in delivering these messages?
Look, I think context is everything. And when community mobilises to talk to their own community, it's so much more, it's the strength of that message and the authenticity of that message is so important, but particularly when that message is coming from Australian members of that community to us people in Australia who are part of that community, because we know things are very different in different parts of the world and people have different ideas about COVID, about managing COVID from different parts of the world. But when we are managing to have that message about what we're doing in New South Wales, what's available for people in New South Wales, why we're asking different things of the community in New South Wales, promulgated within New South Wales by members of the communities themselves, that has been such a strength of our COVID response. And I think it's been a strength of our community response in looking after each other.
Thank you so much, Dr. Jan. And also this week yesterday started the Lunar New Year celebration. So we're requesting people to stay safe as well. Isn't that, Minister Coure?
Absolutely. And today, of course, is the lighting of the Opera House red for Chinese New Year or Lunar New Year. Of course, it's the year of the tiger. It's very important that all of our communities remain safe. Keep following the health advice during the next 12 days of celebration. And for those that are from the Chinese press and those on this Zoom that are celebrating Lunar New Year, I'd like to wish everyone a very happy Lunar New Year, the year of the tiger.
Thank you so much, Minister Coure. And that's about it for us today for our Multicultural Media Online Forum. I'll get Minister Coure to give his final comments and Dr. Jan. But Minister Coure, how wonderful is it to have this weekly forum with the multicultural media?
Look, this is wonderful. It's a great initiative and it's something that we are going to continue. And I want to thank, firstly, I want to thank New South Wales Health. I want to thank Multicultural New South Wales as well. I want to thank all our frontline staff right across New South Wales that are doing such a wonderful job and an exceptional job in ensuring that this pandemic is in control, I should say. And I want to thank everyone in the multicultural media that are here today. This is a very, very important opportunity to, get the important and latest health advice out to our multicultural community groups so that in tune that you can then send that out to your communities as well. So I want to thank everyone who is on this Zoom today.
Thank you, Minister Coure. And Dr. Jan.
Look, I'd just love to wish everyone a very, very happy Lunar New Year. Cheering on for my son's dragon boat team down at the Chinese New Year Festival this coming weekend. And just staying COVID safe. And as we celebrate, remembering when we're indoors and we're not eating or drinking, to wear our masks, encouraging our family and friends to get vaccinated. And of course, if you're feeling even slightly unwell, please don't attend a celebration. Please stay home and get tested and isolate from others. But have a fantastic New Year's festival.
Thank you so much, Dr. Jan. And Minister Coure, thank you so much for joining us. And to you, everyone, Multicultural Media Online, and everyone who's joined us on this session, thank you so much for joining us. And please, list those questions and get them to us and we can answer them for next week on Wednesday, same time, same Zoom link, and we'll make sure that you have your answers and updates on COVID-19. But for now, we wish you a happy Lunar New Year for those celebrating the celebration this week and next week. We hope you stay safe. And for any recordings of the Multicultural Media Online Conference, please go to the New South Wales Multicultural Health website. Be kind to one another and take care.